Morning, everybody. Jacques Roch here. Welcome to our Refraline Vaccine COVID-19 and Understanding Vaccines webinar. You guys would remember, for those of you who attended our previous webinars last year, we covered many different topics: legal requirements, health and hygiene, mental health and COVID-19. We gave a brief introduction to what COVID-19 was. And it's been a year since the pandemic hit our shores. A lot has happened in that time. We've learned a lot of new things. And if you look at our current numbers today, we're currently sitting on about 50,000 deaths in South Africa. Very unfortunate, but total infection rate so far since last year has been 1.5 million. We've also been very lucky to have a high recovery rate of about 1.4 million people. And yeah, I wanted to just thank everybody for all the support we got, specifically from our company side, employees. We also launched a COVID-19 support group on WhatsApp. We've also received a lot of information and support regarding that. We also helped a couple of companies last year to move forward, get their COVID plans in place, undertake risk assessments. We also donated some PPE to companies that were in distress. But we thought about 2 weeks ago that obviously the vaccine is big talk in the media. And in South Africa, you would have seen a lot of media releases regarding vaccines. And so we thought it's time to maybe have a bit of a webinar on vaccines. A lot of the information that's in the media gets into a lot of detail. So we wanted to maybe rather start from the beginning and look at what vaccines are and how they work and all of those sort of things. Obviously, there's still a lot of information that's not clear on South Africa's vaccine program, and we'll maybe discuss that a bit later. I hope everybody can hear me fairly well. I'm running this webinar from my house as the internet connection is more stable. I've asked Nicola to just WhatsApp me in case there's sound problems or visual problems or stuff like that. This webinar will also be available on Refraline's YouTube channel. So if you want to maybe have a look afterwards or you want to share it with somebody, it will be available on our YouTube channel. We're also going to have a little poll at the end. And basically the poll will ask whether you're going to have the vaccine or not. There is a lot of stories around vaccines in general, and this is not new to COVID. It's been happening for the last, let's say, ever since before vaccines even started. There was a lot of controversy around vaccines. So we will have a little poll that we'll launch at the end. We please want to ask that you just partake of the poll. It's one simple question. And yeah, that's my story. I think most of you know me. For those that don't know me, I'm the Group Safety, Health, Environmental Manager for Refraline Group of Companies. I've been doing health and safety and environmental management for almost 25 years, various qualifications in the health and safety field, and registered member with the Institute of Occupational Health and Safety in the UK, as well as a specialist member at the International Institute for Risk and Safety Management. I've done various courses in COVID-19 and have also recently attended a vaccine workshop with the University of Minnesota to discuss vaccines. Again, there's a question and answer button at the bottom, so I will try and check it every now and then. If you want to raise a question while we're going through the slides, I will take some time to look through questions. And at the end, again, you can also always ask questions to see if there's anything that we missed. So the idea behind this webinar was to that when you leave here, you've got a very, let's say, basic and intermediate understanding of what a vaccine is, how a vaccine works, how they're made, and some of the jargon that gets discussed in the media that you would see a lot. So, for example, what is efficacy and what is effectiveness and all of that sort of stuff. And so that you can have a very good understanding of what the vaccine is all about. I will have a slide on South Africa's proposed vaccine program, but as mentioned, that could change. You might have noticed we're not really doing very well with administering the vaccine at the moment. Our numbers are fairly low. I posted this morning, and I'll give you the numbers just now, on currently what the coronavirus vaccine doses look like per 100 people, compared country for country. But we're not doing very well. So this is actually a great opportunity then to explain some of the stuff. And to start off with, we're going to ask the most basic question. What is a vaccine? That is an important question. We hear the story about vaccines a lot, and what it is. And many of us have had vaccines as when we were kids. Nowadays, vaccines are fairly common. You need, for example, to go to school, you need to have a vaccine card with certain vaccinations. So, for example, the Mmr Vaccine, which is the mumps, measles, and rubella vaccine, among others. But there's also many, many different types of other vaccines. When you travel, you can get vaccines for many different diseases, hepatitis A and B, and typhoid and yellow fever, and all of these sort of things that we see. But what is a vaccine really? So when we talk about a vaccine, it's basically a biological preparation. So it's something that's man-made, and that can be administered either via injection or orally, to try and prevent disease. That's really what we're trying to look at. So some sort of biological preparation where we have to do something in a lab usually, and we have to work with some sort of microorganisms to be able to design and, in actual fact, build this vaccine. And as mentioned, can be injected. So you would have known or would have seen in the media that the COVID-19 vaccine can be injected into your arm, or you've seen that in the press where they inject it into the arm. But there's also other vaccines that can be taken orally, via drops on the tongue or something like that. But generally, this is a bit of a technical mouthful, so I'm going to try and break it down a bit for you. And to understand what a vaccine is, we need to know something about the human immune system. You've heard a lot about the immune system and maybe read a bit about it. And a lot of life on Earth is provided with an immune system. So it's not only humans that have immune systems. Animals have an immune system, dogs, cats, animals in the wild, even plants have some sort of a type of an immune system. Your microorganisms, bacteria, all of those things have basic types of immune system. And obviously the job of this immune system is to protect the individual from disease or from getting sick, basically, and so that you can survive. But yeah, humans also have an immune system. Immune system in the body defends us against invading organisms. So we call those invading organisms pathogens. And there's many different types of invading organisms, such as viruses. An example is the SARS-CoV-2 is a virus. There's bacteria such as Staphylococcus aureus, which is found on the human skin. There's parasites such as Plasmodium falciparum, which is the malaria parasite, and many, many others that want to invade the human body and maybe cause disease. Now, not all of these microorganisms are bad or bad news to the human body. We need a lot of them to sort of help us. And you would have read a lot that there's a lot of talk about the microbiome, for example, that lines the gut of the human body, and that we need certain microorganisms to help digest food, keep us healthy. And there's even theories that a lack of certain microorganisms can lead to mental health issues. So a lot of these microorganisms are not all bad. We need a lot of them in the environment, but unfortunately, some of them are not so good, and a very small amount of them, unfortunately, want to do you harm. And so we need this immune system of ours to prevent us from, or to minimize the harm, or prevent us from harm. And as mentioned, these microorganisms, or these pathogens, as we call them, bad news microorganisms, that's the way to think of the word pathogen, as a microorganism that wants to cause you bad news or cause you to get sick. They invade the human body, and they invade the human body for various reasons. So some invade to reproduce, some have to invade to survive, some have to invade your body to obtain information, to help them reproduce, and use that information is required to pass on to other pathogens. So it's sometimes in this process that damage can occur to the human body. And there's various ways that pathogens can damage the human body and the immune system. So sometimes what will happen is that the pathogen, when the immune system is fighting this pathogen, it can kill some of the cells at the site of invasion. You can also have where the immune system overreacts, and you start developing something called autoimmune disease. But some of these pathogens can also cause chronic illnesses such as HIV/AIDS, cancer, and even death, as we've seen and heard a lot with SARS-CoV. I just mentioned that 50,000 people have unfortunately passed away from COVID. So yeah, they can even cause death. The good news is that through the process of evolution and millions of years of being exposed to these pathogens, the body has been able to devise this very clever system to help us fight off these pathogens. And I want you to think of the immune system as a mighty army. It's probably the easiest way to think of it. It's a very complex topic, and the study of the immune system and immunology is a fairly new science. It's about possibly 50 to 60 years old, somewhere around there. So it's a fairly new science, and every day they seem to learn something more about the immune system. So a very complex system, very intelligent system, but easy way to think of it as an army, or as a mighty army, as I like to call it. So this immune system that you have in your body consists of many different cells. Here's a list of some of them. These aren't all of them, but you've got something called, like, for example, natural killer cells, cytotoxic T cells, helper T cells, dendritic cells, macrophages, B cells, plasma cells, neutrophils, endophils. And these are all the cells that make up your immune system army. And when we talk about the immune system, we talk of mainly two branches. One is called the innate immune system, and one is called the specific immune system. So the innate immune system really is your basic immune system. And I say basic, but there's nothing really basic about it. But that is the one that's the first line of defense, if you want to think about it that way. First line of defense. And then you've got the specific immune system, which is a lot more specialized. and obviously is a little bit more advanced in terms of thinking of an army. So think about drones and very fancy fighter jets and tanks and technology. That would be the way to think about the specific immune system. So our immune system, as I mentioned, incredible advanced system. And once you start trying to understand or study the immune system, it becomes rather complex. But generally, we have the immune system, which is produced in mainly two areas of the body. One is the thymus and one is in your bone marrow. And you can see here's a little diagram of immune cells being produced out of bone marrow. So you have dendritic cells and macrophages. And I'm not going to go into all of these different functions of immune system cells. Like I mentioned, some of them are extremely complex to understand, and I'm not an immunologist at all. So yeah, it gets rather complicated on what does what. And sometimes there's an overlap of these cells. So you might think that a dendritic cell will communicate with the specific immune cells and activate that. But then again, there's other cells that do the same thing. So it's quite complex to understand. But all we know is that there is in this immune system, this wonderful immune system. And just as an army consists of many parts, such as generals who coordinate the army, soldiers, tanks, aircraft who bomb, and a communication system, the immune system also has these functions. It also has generals that coordinate the immune response. It has soldiers. It has advanced communication systems to communicate with all the different parts of the immune system. And this communication system is incredible. It's advanced. It communicates within seconds, basically, via chemical markers. But as a normal army would, the immune system needs to remember who attacked it and how it was attacked. I think I've put attached there, but it means attacked, sorry. So obviously when one army attacks another country, that army will remember who attacked it and how it was attacked and when it was attacked and which borders were breached and how did the invading army, what did they use in terms of tactics to overcome the local army. And so the immune system works in the same principle. So important part of the war is that your immune system needs to remember also who attacked it and how it was attacked for it to mount an effective defense. Because what will happen is you'll be attacked by possibly a invading pathogen and you would recover. But that doesn't mean you're not going to get infected and attacked the next time around. So let's say you might be attacked by the flu virus this year, winter, or by something else, and you recover fairly well, but it doesn't mean that maybe next year you can't get the same infection. So the immune system needs to remember who are these attackers and how did they attack you for it to mount an effective defense. But as you can imagine, and as you probably know, that the system is not perfect because in order for you to be able to mount a defense, you need to be infected. So you need to be infected by these microorganisms for your body to mount an effective defense. And the problem is also that this can sometimes be slow process. So you will know that if you see with people that are infected with SARS-CoV-2 is that they start showing symptoms. We know what the symptoms are already. And we also know that slowly things can get out of control. So these viruses can hoodwink your immune system to do things it's not supposed to do and fool your immune system into thinking that they are good guys and not bad guys. And then they can infiltrate your army and start destroying parts of your army that you maybe need and cause havoc or cause the army to attack itself. This happens, and we know it as autoimmune diseases. So it's not a perfect system as such, because you need to be infected, and sometimes it takes a while for your specific immune system to kick in. Your innate immune system is always on guard. So I think the way to think about it is, think about it as, if you think about breaking into your house, you've got your armed response and your alarm, which is the innate immune system. And then you have the specific immune system, which is the specialized police, such as SWAT and detectives. And I don't know if that's a good analogy in South Africa, but I think you get what I'm saying. So the innate immune system will always be on guard and will always be the first to react to an infection. But the specific immune system can sometimes take time to respond. And you can imagine some of these pathogens are fairly clever. I like to say that I have a lot of respect for the SARS-CoV-2 virus, because in my view, although you can't say it's intelligent, and scientists debate whether viruses are intelligent or not, in my view, they are, because it finds ways of evading your immune system and making you sick. So yeah, it's not a perfect system, but it is a very effective system. Okay, so how do we just check if there's any questions? Everybody's still on. Okay, cool. So how do we overcome this flaw, or how can we prime the immune system so that before you are attacked by a novel pathogen, we can prepare it? Because that would obviously be prize number one. If we could allow your body, or prime your body for something that's still going to come, then when it infects you and attacks you, you would be ready. Your immune system would be ready and would know how to deal with this pathogen that you've now been infected for the first time. So we need to find a way to warn the immune system before the first attack. And to do this, we use a vaccine, this biological preparation that we spoke about. So that allows us to, first of all, prime the immune system and tell it that, look, there is this pathogen and you could be exposed to it. And when it comes, this is the way to attack it. So please remember, if it ever comes and you ever are infected, this is the way we're going to deal with it. And that's what it does. And in doing that, it can minimize a lot of damage to the body, and we can get on with our lives, basically. We've seen the horrendous effect that COVID-19 has had on business and the economy and the world in general. And it's amazing to think that, I always say, something that's 100 nanometers wide, which is literally, you can only see through electron microscope, can cause so much havoc in the world. And companies have closed, and businesses have closed, and economies have tumbled. So if we could find something that could minimize all of that damage, all of it, the death, the destruction to the economy, well, then it could be quite a big thing. We could actually carry on with our lives in general. And we've seen that, although we've been through a couple of lockdowns now, they're not the most effective way to try and protect people, because humans are humans at the end of the day. And we will still sometimes do things we're not supposed to do. So we will get infected. So if we could have something that could help protect us, and it could sit in the shadows in our body, so that when this thing comes, we're ready for it, well, then it's worth looking at and worth investing in and worth taking. So that's what a vaccine does. And you need to think of a vaccine as a super spy. So in this war that your body is waging with your immune system army, you're going to have a James Bond. And it provides the immune army with the info it needs to mount the correct response when attacked. You don't want your body providing the incorrect response, because if it over responds, it's not a good thing. If it under responds, it's also not a good thing. So you want it to be able to provide just the right amount of response. And we've seen with SARS-CoV-2 that in some instances, for some reasons, the virus does fool the body into over-responding. You've maybe heard of something called the Cytokine Storm, where basically instead of sending the foot soldiers and maybe the tanks to the area of infection, which in this case is the lungs, for some reason the body sends the whole army, the whole Air Force, the whole Navy, it sends everything it's got to this one area of infection. And that causes problems because the immune system is very powerful. So it starts attacking itself. It starts attacking the body itself. And we don't want that either. So we want just the right amount of response to this invading pathogen. And that's what the vaccine helps us to do. It helps us to mount the correct response. And that's a very important point to always remember, is that if you don't have a vaccine, you don't know what the response is going to be. It could be that you would have the correct response. And I mean, obviously, I mentioned we've had 1.4 million people recovered. So obviously, there's been some people with a correct response. Unfortunately, there's been some with too little response, and we've had death. But we've also had people where it's gone totally haywire, and people have suffered from the symptoms of long COVID, where although people have recovered, they're still suffering from some sort of symptoms of COVID after 3-4 months, and some even after a year. So yeah, you want that correct response, and that's what the vaccine helps us to do, is it helps the body to try and coordinate the correct response. So how is a vaccine made? Well, it's a very simple concept, really. In order for this vaccine or this super spy, it needs information. Like anything else, when there's a war, information is king. So you want to go and gather information on your enemy. And when we watch a lot of movies and we see how people spy on other people and on other countries and whatever. And why are they doing that? They're trying to gather information so that they know what to do when there's an attack. What does the enemy have? What tools does the enemy have? What arsenal does the enemy have? So what we do is we need information on the pathogen to be able to prime the immune system. And to do this, we need to study the virus. Obviously, they study the virus, but they need to take a piece of that virus and present it to the immune system, because that's the only way the immune system will be able to activate and recognize the pathogen. You need to take a piece of it, unfortunately. There is no other way to do it. You can give it information, which is the new way of doing it. But the old way has always been to take a piece of it and via some form of injection or oral preparation to present it to the immune system for priming. So there's various ways of doing this. The 3 basic ways that they do this is by taking a whole pathogen. So they'll take a whole virus, for example, and remove all the genetic material and inactivate it to make sure it is dead. Although the virus cannot replicate, it still has a protein lipid layer or shell that can be used and injected into the body and presented to the immune system, so that the immune system develops what we call memory. And there's specific cells in the innate, in the specific immune system called B memory cells. These cells are highly specialized and they can actually remember what a pathogen looks like. So we can take an inactivated whole virus and present it to the immune system so that these memory cells can remember what they look like. And they do this by tagging the virus and tagging specific types of cells in the immune system. You can also take portions of the pathogen. So you don't have to take the whole virus, for example. You can take just parts of it. So, for example, you'll see we could take, for example, the spike protein, that little funny little thing you see there that you always see with COVID, is the spike protein that is used by the virus to latch on to the receptor in the lungs. We call it the ACE2 receptor. And you can take a part of that and you can make a vaccine out of it. And the immune system will then say, oh, okay, this is part of the invading army. So I need to look for this. And you can think about it this way. When an army invades, they will have sometimes a flag of a country on their sleeves. So the immune system will work the same. It will then look for this flag on the virus, and it will see, well, this is not a friend, this is not a friend, it's a foe. Therefore, I need to mount an attack. The other way of doing it, which you may have heard a lot of, is by using genetic material. So this is newer, the latest technology, and it's come from, was started with the development of the Ebola vaccine, where they looked at taking genetic material. So for example, in SARS-CoV, they would take the RNA material, which is the genetic code to manufacture new viruses. They would take a piece of that, not the full thing. They'll take a piece of it and also put it in a package and present it to the body so that the body can recognize the next time around this thing. So it's all based on the same principle, in that taking a piece of the pathogen and packaging it into a envelope or a box, if you want to think about it this way, and then presenting it to the body and the immune system, which then creates some sort of memory of this pathogen, so that when you are invaded and attacked, your body knows what is the correct response. And obviously it can then be a quicker process, not that the body has to now scramble and understand what are you being attacked by. It knows, it has some memory. It can tag the invading pathogen and mount the correct response. There are many vaccine preventable diseases through the years. Many of you will know them, but some of them, like I mentioned, there's measles, mumps, rubella, the Mmr vaccine. You would know that the Mmr vaccine has caused a lot of controversy in the last couple of years because of the fake, or I wouldn't call it fake, but study that came out from Kevin Wakeford a couple of years ago on that the Mmr vaccine causes autism. As of such, today there has been no link between autism and any vaccine. And vaccines have been studied in lots of different ways by lots of different specialists and scientists. And I saw a study that came out, I think 3-4 years ago, of a group of about 1 million people that were studied for side effects from vaccines. So there's many different types. I mean, hepatitis A, hepatitis B, rotavirus, varicella, rubella, mumps, measles. We also, as you would know, have a vaccine for the flu. And the flu vaccine is quite an interesting vaccine, because although you can take it for this year, unfortunately next year it's not really valid to the new strain of flu. So strain So flu can mutate into a new variant almost all the time. And you need to then get another vaccine the following year for the new flu strain or variant that has come out. But you also get for tetanus and many other different. So this is just an example of some of them. There is some of them that's not here. So vaccines aren't a new thing. Biggest question is, what is in a vaccine? Because it's not just the active ingredient that we discussed previously, a small amount or part of the invading virus. There must be other things also. As I mentioned, there's a package that gets put together. And this package has to consist of certain things. So obviously it's got the active ingredient, as we mentioned, the main ingredient, which is then water, obviously, to make it soluble. But you also have certain other stuff added to create stronger immune responses. You have preservatives and stabilizers so that we can store it. Any medicine that you buy will have some sort of preservative or stabilizer in it, so that it can be stored for a certain amount of time, and that the active ingredients don't lose their potency. So, but there's also residual traces of other substances, and that can happen during the manufacture of, and that's, for example, formaldehyde and certain chemicals, but these are in such small trace amounts, and you're talking about parts per billion here, that they don't really have an effect on the body. And these vaccines are generally safe to use. I read an article this morning, I think it came out in the New England Journal of Medicine, where they've now looked at, in fact, I've actually got it here, and I just want to read to you what it says, if I can find it now. And they've actually looked now through the SARS-CoV-2 virus on possible side effects. So one of the side effects that was reported, for example, was an allergic reaction to the vaccine. And we've looked at the numbers here, and they say, sorry, I'm just looking for yeah. So the rate of anaphylaxis is an allergic reaction your body has towards something that's invaded it. So the rate of anaphylaxis among 65,000 healthcare employees on getting the mRNA vaccine. And the mRNA vaccine is very simple. It's just part of the virus, where you will see I showed you this little spike protein RNA. That is an mRNA vaccine. So they take that little piece of genetic material and they package it into this little vaccine. So employees getting the mRNA vaccines was 0.025%, and all recovered. 98% had no sign of any acute allergic reaction. So there are obviously a response to the vaccine, and we've seen that sometimes your arm will swell from a vaccine. That is normal, because remember, it's again an invader. It's an invader invading your body, so the body will have some sort of reaction. So your arm might swell a bit, but there are people that can sometimes have an allergic reaction to some of the preservatives. And 98% of them do recover from that. All right. Just check if there's any questions. So you've heard this concept of herd immunity, and it's very much related to why you should be vaccinated. The concept of herd immunity is a very simple one when it relates to vaccines. And again, if only a few people are vaccinated, then one person who is infected can spread the disease very fast. So, but if we vaccinate a lot of people, then the disease can spread very far and the whole community stays safe. So if we don't vaccinate enough people, well, then the infection will carry on spreading to people that are not vaccinated. However, if we can vaccinate enough people, then we can actually protect not only the vaccinated people, but the small amount that is not vaccinated, because the disease can't spread anymore. And you would have heard maybe in the media that we know that the amount of herd immunity required to stop community spread of SARS-CoV-2 is about 67%, round about there. So if we could vaccinate 67% of the population, we could possibly stop the spread of the virus. And it could become something that's endemic, for example, like measles or mumps or something like that, chicken pox, if you want to think about it that way. So herd immunity is very important. Obviously, it takes a long time to achieve. The quicker you can vaccinate people, the quicker you can achieve herd immunity. And a lot of countries have put all their effort and resources into vaccinating people as quickly as possible. The country that stands out the most at the moment is Israel, who is leading the world in vaccinations. And we're waiting to see now, when they reach herd immunity, what effect will it have on the spread rate of SARS-CoV-2? How will SARS-CoV-2 change? So that's how vaccination is related to herd immunity. And you can also achieve herd immunity by natural infection. So you would know that the 1918 Spanish flu pandemic, there was no vaccine for it, because in 1918, immunology and bacteriology was not well understood. So vaccination was a far concept still. And there was no vaccine for the Spanish flu pandemic. So it had to kill a lot of people, and the estimates are anything from 1 in 5 people on the planet died from Spanish flu, somewhere around there. They don't know the exact amount of people that died, but it affected every country in the world as well. And a lot of people had to die so that we could achieve herd immunity at that time. Remember, it's in the virus or the pathogen's interest not to kill everybody, because if it kills everybody, it cannot spread anymore. So due to genetic variance in human biology and human immune systems, some people will be immune, some will survive, some will unfortunately have to pass. And from that, we then get natural herd immunity. Obviously, you don't want to wait for natural herd immunity, because you don't know whether you're going to make it or not. So the vaccine is the best option to try and achieve herd immunity as quick as possible. How effective is vaccination? So here's 3 cases of vaccines, and you can see these are what we call celebrated vaccine. Diphtheria. Diphtheria vaccine usually is given to babies when they're born. Diphtheria is a diarrheal disease that can kill. So, no, sorry, I've got the wrong one. Yeah, sorry, diphtheria is not a diarrheal disease. It is a respiratory disease. I'm thinking of something else. So it is a respiratory disease that killed a lot of kids. It also infected the lungs, and I think it was called the black angel, or the angel of death or something. In that, what it used to do is it created a small film layer in the throat that grew in the throat, and it prevented oxygen from reaching the lungs. So it was a very, very dangerous disease from 1910 to 1940. Roundabout after 1940, they there was the introduction of the vaccine, and you can see I haven't heard of anybody that's had diphtheria. I haven't heard of anybody since that's had, maybe you know of somebody, but there is a vaccine for it. It's given routinely to kids nowadays. So I don't know. There are cases maybe somewhere in the world where you cannot get the vaccine, but I don't know of any cases of diphtheria. I'm going to look at the measles case rather and explain to you that the measles is probably one of the most infectious diseases in the world. So for those of you that attended our different COVID webinars, you would remember we spoke of the spread rate of a disease. And we know that measles has the highest spread rate of any disease in the world. So for every one person that is infected with measles, you can infect 14 different people. And compare that to SARS-CoV-2, where we know it's between 4 and 5. So measles is a highly infectious disease, but it's also a very dangerous disease. It can cause problems when you are older. So we know when kids get measles, it's something that comes and goes fairly quickly. But in adults and in 2% of people that get measles, there can be serious complications in terms of swelling on the brain and stuff like that. And in 1968, there was an introduction of a measles vaccine, obviously the MMR vaccine. So what they did was they took 3 vaccines and made it into one, measles, mumps, and rubella, instead of giving everybody separate vaccines. Many of us that are a bit older will have that mark on our arm, that famous mark, and that is the MMR vaccine. Today, it's a lot more friendlier, but yeah, it's still, so yeah, measles is a very infectious disease, but it has been controlled through the introduction of a vaccine. But there are a lot of reasons why people don't want vaccines. And I mentioned earlier on that there are a lot of myths regarding vaccines. Specifically, the most famous one is that it causes autism. Again, there is no scientific basis at the moment for any vaccine causing autism. But this was a study that was done recently on reasons for not wanting to be vaccinated against COVID. And they interviewed 135 people with multiple answers. Over 90% said they are concerned about potential side effects of the COVID-19 vaccine. Over 80% said, I think the COVID vaccine may not be safe. Over 20%, I do not think that COVID-19 is dangerous to my health. And I think the COVID-19 vaccine may not be effective, was close to 30%. I can prevent COVID-19 with precautions other than vaccine. Over 10%, I am confident I will not get infected with COVID. I'm against vaccination in general. There you could see those are what we call the anti-vaxxers. They are over 20%. I'm afraid of injections. Funny enough, common one. You can see the distribution between male and female. And there was nothing for religious reasons why, I don't know. But you can see that the large majority is I'm concerned about the potential side effects, and I think COVID-19 vaccine may not be safe. Those are the main reasons for not wanting to take the COVID-19 vaccine. And as I've just mentioned, the side effects that we see at the moment are mostly anaphylaxis or allergic reaction, very small amount of people that have had that sort of effect, and obviously swelling of the arm. In some people, it's a bit bigger than other, but in general, no serious side effects of the COVID-19 vaccines has been recorded as such yet. Vaccine or vaccination innovation, and here you can see is another slide on many different diseases or common diseases and the effects that the vaccine has had and when it has had the effect to stop the disease. So you can see here, we've got malaria from 1880. There is currently work being done to develop a malaria vaccine. Last year, there was a very interesting article that came out on how far they are with trying to establish a malaria vaccine. And obviously, we know that malaria is one of the main causes of death in Africa. So about 1 million people a year die from malaria. If you go into Africa and you ask them, what's the biggest thing you deal with in terms of infectious disease, they're not going to tell you COVID, they're going to tell you malaria. It's always malaria. TB, still no vaccine for TB. Typhoid fever, there was a vaccine that came out in 1989, I think it was. Meningitis, whooping cough, dengue fever, still no vaccine for dengue fever. Also very debilitating disease caused by mosquitoes as well. Polio, obviously we know there was a polio vaccine that came out in 1955. Very interesting story around the polio vaccine. Zika fever, also caused by mosquitoes. Still no vaccine for Zika. And we know Zika does cause microcephaly in babies. So babies are born with this small head. You would have seen it in the media. Chickenpox, we have a vaccine. Measles, we have a vaccine. Birth defects from mononucleosis, no vaccine yet. Hepatitis, we have some sort of diarrheal disease. So rotavirus, we have a vaccine. Ebola, although it shows here that we don't have a vaccine, we now know that there is a vaccine available and is being stockpiled to treat one variant of Ebola, known as the Zaire variant. Cervical cancer, there is a vaccine for women to prevent cervical cancer. And obviously, the other big one that many of us born in this century know about is HIV/AIDS. As such, no vaccination or no vaccine available yet, although they are moving much closer to achieving a vaccine. And then obviously COVID-19, we know that there is now vaccines available for COVID-19. So the science of vaccines have been around for a very long time. People often ask me, or people often say, and it's a valid concern, that I'm scared of taking the COVID-19 vaccine because it's been made too quickly. And it's a valid point because on average, it takes about 8 years to develop a vaccine, a new vaccine. But the COVID vaccine is not theoretically a new vaccine. A lot of what was done in terms of technology and design on the COVID-19 vaccine came from the development of the HIV/AIDS vaccine, or HIV/AIDS study, sorry, not vaccine. A lot of study went into studying the immune system with HIV/AIDS. And obviously, like I said, they are busy trying to design a vaccine. So a lot of knowledge came out of that. Also the Ebola vaccine. But many of the old vaccines also contributed to the study of how vaccines are designed. So it's not like we're designing new vaccines. The technology regarding how vaccines are designed has been around for a long time. The only difference is it's a new type of pathogen, where maybe in Ebola, it was a different virus, the Ebola virus. Now it's, for example, COVID-19. But the technology has been around for a long time. It's not new technology. The way we make vaccines has been around for a very long time. Okay, so top 5 myths regarding vaccines. You would have heard of some of these. Myth number 1, the effectiveness of vaccines has never been proven. Well, I've just shown you that that's not quite true. When last have you heard of somebody that had polio or measles or every now and then you might hear of a measles case. But I haven't heard of anybody that had polio or diphtheria or something like that. I haven't heard of it. One of the most successful vaccines ever developed was the smallpox vaccine. It's been the only disease that has been declared eradicated by the World Health Organization. It's a phenomenal story about how the smallpox virus was eradicated through vaccines. So it's the only disease we've been able to eradicate completely. And smallpox is a very debilitating and hazardous disease to people, causes a lot of scarring. But yeah, it's one of the first diseases that's been eradicated by human beings. So yeah, they talk about measles and polio since the mid-1900s. Vaccinations cause the disease that they are meant to prevent. That's myth number 2. Vaccines contain dead or weakened viruses or pathogens. So exposure to these help the body recognize and produce antibodies to protect against the disease. So again, we're not taking a whole live virus and putting it into your body basically to infect you. We're taking parts or dead parts of a weakened part of a virus and using it as a piece of information to prime the immune system. Myth number 3, I don't need to vaccinate if everybody else does it. Well, I explained the concept of herd immunity and herd immunity reduces the chance of an outbreak when a large percentage of a community has been immunized against the disease. If too many people don't vaccinate, it opens up opportunities for disease to establish themselves and spread, especially to those who are medically vulnerable and cannot be vaccinated. So you are going to get people that can't be vaccinated, but that's a small part of a population. So if we can vaccinate enough people, we can protect not only ourselves, but we can also protect those people that cannot be vaccinated. So for example, people that are immunocompromised cannot necessarily be vaccinated. So they are at risk to get any sort of infection. So if enough of us vaccinate, then we can protect those people as well. And it's important, if we want to move on from COVID-19, that we all seriously consider to be vaccinated. The next myth, vaccines cause health issues in children. Again, there is no credible scientific study linking vaccination to autism. Again, this, as I mentioned, stemmed from one specific scientist called Kevin Wakeford, who published a study in the New England Journal of Medicine a while back, and this was discredited. I'm not sure. I heard that he did lose his medical license. Whether it's true or not, I don't know. But it caused a lot of harm because a lot of parents, after that article came out, then refused to vaccinate their kids. And that caused increases in cases of measles and some other diseases. There was some deaths around it. So, yeah, there's no credible scientific study linking any vaccine to autism. And then the last myth is vaccines aren't worth the risk. Now, I don't have to go much into that one. We've seen what COVID has done, as I mentioned. So in my view, COVID is well worth, or the vaccine is well worth the risk to prevent COVID. And so that we can try and get some sort of normality back in the world. So in my view, yes, small risk, big reward or big benefit. If you think about it in terms of benefits and risks, there is a small risk that you could develop an allergic reaction. Again, that's why we the risk or the vaccine is administered by healthcare professionals in a healthcare environment. It's so that if there is a risk that you are going to develop some sort of anaphylaxis, that there is healthcare professionals to be able to deal with that. So small risk, but big benefit in that we can get back to normal. Yeah. All right, so when these vaccines are designed, there's different phases to design a vaccine. And this is why they usually take so long. It's because there's a body in America, one of the biggest bodies called the FDA, Federal Drug Administration, that has to approve these vaccines for human use. And there's different phases that they have to go through. So for example, you will get the preclinical phase, which involves testing on animals, testing outside the body in specific types of, so they could even do tests with the virus and parts of the human body, such as blood or cells or whatever outside of the body. That's the preclinical side. If it passes that, it then goes to phase 1 of the trial, and that is where it's usually between 20 to 80 participants. These are voluntary studies, so you can volunteer to partake in a clinical trial. If it passes that with no extreme side effects, then you go to phase 2, which is 100 to 300 participants. And remember that when these trials happen, they are what we call randomized controlled trials. So what will generally happen in a randomized controlled trial is there'll be a placebo group, and there'll be a group that then will receive the drug. These are randomized, so nobody knows if they're in the placebo group or the drug group, if you want to call it that. The placebo group will receive a drug, but it's usually a placebo, such as a sugar pill or just water in a vial, whereas the drug group will receive the real vaccine or the real drug. Then in phase 2, it's a bigger trial, so there'll be between 100 and 300 participants. You then go to phase 3, which is 1,000 to 3,000 participants. And then the FDA has a review of the safety and effectiveness of the vaccine. So they look at all those trials, look at side effects, see what side effects affect who, and then decide whether it's safe to carry on. And then you obviously get the phase 4, which is a much bigger study, more than 1,000 people. So those phase 4 trials are usually something like sometimes between 40 and 60,000 people. Now you would have known that SARS-CoV-2 vaccine went through preclinical. It did go through phase 1, phase 2. At phase 3, it was then given emergency authorization use because we needed it fairly urgent in the world. So they did trials up to phase 3, and then the FDA reviewed it and gave emergency use authorization to be able to use it. So in theory, we are now in a phase 4, where there's a lot more people, but you'll see the numbers on the trials just now. Those are just estimates of numbers. Okay, once again, on the SARS-CoV-2, as mentioned, there's 3 ways to manufacture that. So one is to take a viral vector. So we use, for example, we can use an mRNA part of the virus or RNA part of the virus to produce the vaccine. You can use the spike protein, which is then applied to a vector. And then the immune system produces antibodies. Antibodies are markers that are created by the immune system to mark the offending pathogen when it comes in. So when it enters your body through an infection, the immune system will market with an antibody. And those antibodies indicate to the immune system that this is something that's not supposed to be here, let's attack it, and it then sends the required response to destroy the pathogen. And these, as mentioned, are, you would have heard of mRNA vaccines that have been developed. No different to any other vaccine, it's just newer technology that has been used, and it can be manufactured fairly quicker than using that technology. All right, so one of the most misunderstood aspects of vaccines is efficacy and effectiveness. You'll hear people talk a lot about the efficacy of a vaccine and the efficacy number and the effectiveness. And these are two different things completely. So efficacy is how well the vaccine performs in preventing disease during the trial stage. So remember, I showed you those trial numbers, and they will then study how well this vaccine performs in preventing disease. And they will give a number. And remember, that's ideal conditions because it's based in healthcare environment. People are closely monitored and studied. So if they tell you a vaccine has an efficacy of 90%, that number was produced during the trial stage. Effectiveness is how well the vaccine performs in preventing disease on the ground, as we call it. So we currently now going into an effectiveness stage of measuring the effectiveness of the vaccine around the world because we've started administering it. Very important note to note here is that the vaccine does not prevent infection. So if you get the SARS-CoV-2 vaccine, it's not going to prevent you from getting infected. The virus will still infect your respiratory systems, but it will prevent serious disease and death. And possibly you will only get a mild disease, like a little bit of a sniffles, and you will move on. So it's not going to prevent you from getting infected. And I think that's also where the bit of miscommunication is. The people think if they get the vaccine, they're not going to get infected at all. You can still get infected. It's just not going to cause death or serious disease. So always remember to look at those two when they talk about efficacy and effectiveness. One measures how well the vaccine performs during the trial stage, and effectiveness measures how well the vaccine performs on the ground. So we all know that I've put on here just the Johnson & Johnson or the J&J vaccine trial. This was the efficacy numbers for the J&J vaccine. I didn't put for Astrazeneca and Moderna and Sputnik and all of those. I specifically put for J&J because that is currently the one that's being used in South Africa. And you can see how those numbers are calculated. So they have the placebo group. And out of that, for example, there were 63 per 5,000 volunteers contracted COVID-19 in the placebo group. But in the vaccinated group, it was a lot less lower. So they always took the same number of volunteers, 5,000, to be able to compare. And then in the vaccinated group, they only got 18 per 5,000. And then the efficacy estimate was that 72% fewer cases in the vaccinated group than in the placebo group. So that is how the efficacy number is calculated. There is a formula to calculate that, but in simple terms, that is how they come to that efficacy number. Okay, so here's just a quick slide on vaccine efficacy and COVID-19 compared to other diseases. So you can see vaccine efficacy for tetanus is 100%, for Ebola, 100%, rubella, about 95, between 95 and 98, measles, about 80-something%, and obviously you require a second dose. Chickenpox, polio, mumps, and rotavirus and flu. And you can see COVID-19, obviously this is an average, so you're looking at about between 75 and 95% on efficacy for COVID-19. And that is one huge achievement. To think that they were able to develop and design that vaccine within 8 months is astonishing. It just shows you what can be done when we build on technology, and when we have the will to do something, we can do it fairly quickly. So yeah, that's a very interesting slide on vaccine efficacy compared to other diseases. COVID-19 vaccine myths and facts. So what are the myths? They aren't safe because of how fast they were created. And again, I mentioned that it does seem like they were made fairly fast. I just mentioned it took 8 months. But the technology for developing the vaccine has been developed over many, many years. So developing the vaccine was done on the back of many different technologies that was designed with using other vaccines through the years. Fact, non-clinical, clinical, and manufacturing information for both vaccines was reviewed by a data safety monitoring board before emergency approval. So the FDA has this, what we call data safety monitoring board, that will look at all the trials of where they are and then decide before emergency approval. But again, don't think of it in terms of 8 months. Think of it in terms of the last 100 years, basically, in that vaccines have been produced in the last 100 years. They can cause people to have serious side effects like Bell's palsy. Serious side effects from both the Pfizer and Moderna vaccines were rare in clinical trials. So as mentioned, very rare in clinical trials. People were concerned about allergic reaction, which I've seen as being one of the biggest side effects, but very small amount of people that will have. I did hear of one woman that had a severe allergic reaction in the States, but as mentioned, she was in a healthcare facility, so they could administer the required medicines to help her. They will make people sick. The most reported side effect from either vaccine was an injection site reaction or injection site pain. Your arm will swell a bit. Some people's arms swell a bit more. Again, that's just an immune reaction. It happens the same with a lot of different vaccines. A couple of years ago, I went for the typhoid vaccine. I was traveling into Africa, went for the typhoid vaccine, and my arm was pretty sore and swollen for about 4 days, somewhere around there. That's nothing unusual. Didn't feel any side effects from any vaccine as such. So yeah, there's a lot of myths and facts. Obviously, South Africa's vaccine program started with the Astrazeneca vaccine. You would have remembered in the media that there was a big hoo-ha regarding the Astrazeneca vaccines that came into the country about 3 weeks ago, 4 weeks ago, somewhere around there. President was at the airport and off the government. There was a big celebration as I got off the plane. And then about a week later, it was all put on hold because of the variant, the South African variant to SARS-CoV-2, which then reduced the efficacy of the vaccine tremendously. And it was then decided to send them back. I'm not sure where these vaccines are now. There is talk that it's gone back. Whether that's true or not, I don't know. My view is that I think it was the wrong idea to send them back, because although the efficacy numbers dropped, it could have still been given to certain individuals in society and we would have still been fine. But yeah, that is what happened. So you can see in this cartoon where the vaccine is saying, I don't know, I don't feel so, I feel inadequate. Those vaccines were never used. All right, so let's look at the main efficacy findings between, I've put 3 different vaccines here, the Novavax, the AstraZeneca, and the J&J. Obviously, we know South Africa started with the J&J vaccine. That is the one currently being administered to all healthcare professionals. And you can see here's the efficacy study findings, the number of participants, 4,422 for Novavax. J&J was 10,900, Astrazeneca was 2,000. Now, the interesting thing is both the Novavax and the J&J participants included South Africans, so those efficacy trials were done in South Africa as well. And then you can see the main efficacy findings. So the Novavax, 60% efficacy in HIV negative, 49% efficacy in HIV positive. So obviously, we know that HIV/AIDS affects the immune system, and that sometimes it will try and wipe out those memory cells. So that's why they put the HIV negative, HIV positive. So you can see the efficacy drops a lot between HIV negative and HIV positive, but that doesn't mean it doesn't have any efficacy. 50% is still good enough to provide some sort of protection. The most important point there is no hospitalizations or deaths in SA. So that's good news. You still might get sick, but you won't necessarily go to a hospital and you won't die. J&J vaccine, 57% efficacy in moderate severe disease, 72% in the US. And the reasons why the numbers are different is because that 57% is based on the new South African variant, the 501V2 variant that you might have heard of. So in the US, they have other different variants, and there they found the efficacy to be 72%. Important points here is 85% against severe disease, 100% protection against death, no hospitalizations or deaths in SA. And that came from, as I mentioned, the study was done in South Africa through the South African Department of Health. So the good news, 80% against severe disease, 100% protection against death, which is the most important one, I would say. And then obviously the Astrazeneca vaccine, 2,000 people, minimal protection versus mild, moderate infections, and the details are pending. And that's obviously where the story of the variants are coming in. We're also seeing a lot of other variants. Somebody asked me yesterday about the variants, and we know that there's currently 3 variants of concern you would know about. That is the Brazilian variant, the P1, the South African variant, and the UK variant. These did cause a bit of havoc. And I know in Brazil's currently leading the world in infection numbers because of the P1 variant, which is the main variant affecting the people in Brazil. In South Africa, we've got the South African variant. We like to call it 501V2, or Y2 variant that has mostly started infecting people since October, November last year, caused our numbers to substantially go up. You would have seen the COVID numbers go up substantially in October, November. The death rate also went up, and that is probably due to the new variant. And then obviously there's 3 new variants of interest. So there's 3 variants of concern currently and 3 variants of interest. The 3 variants of interest come from the states, the California, the New York. I don't remember what the other one is, but these are all currently seems to be coming from the states. It's not unusual for it to come from the states because the states have had large numbers of infections. So the more infections, the more the virus will mutate into variants. So you can see from this that the J&J vaccine, very effective to protect against death and hospitalizations, which is the 2 main things you want to look for in terms of public health. We don't want to overburden the hospitals, so the vaccine is very, very effective against that. And obviously, we want to prevent death. Like I said, you might still get some symptoms. So it's not saying that you're not going to necessarily get symptoms, and you could still get infected. But good news is that 100% protection against death. Okay, so what is the plan? What is the plan at the moment for me is a bit, to use the Afrikaans word, de mekaar. all over the place, but this was the vaccine plan that was published by the South African Department of Health. There was 3 phases. Phase 1 was frontline healthcare workers, target population of 1.2 million. We're on average vaccinating about 6,000 people a day. That's not good news at all, because 6,000 people a day is nothing. In order for us to achieve that 67% herd immunity, we're going to need to vaccinate at least 200,000 people a day in South Africa. At our current rate of vaccine rollout, we'll be busy for the next 20 years. So I'm going to be on pension when maybe I get the vaccine. So something has to happen. It's way too slow. You can see, for example, in the UK, they're doing, I think, 1 million people a day now. And the US has also really sped up its vaccine, delivering its vaccine to its population of people. But in South Africa, definitely we have a problem. So yeah, 6,000 people a day. We haven't even got through all the healthcare workers yet. Phase 2 then looks at essential workers. Target population is 2.5 million. Those are people like policemen, firefighters, those sort of people, and persons in congregate settings. Very controversial point, because they're talking about people in prisons, people in healthcare settings such as old age homes or stuff like that. And then people over 60. My dad is phoning me weekly now, asking me when will he get the vaccine. So unfortunately, Dad, I know you're on the thing, but you are phase 2.3. There's about 5 million of you apparently. So I can't tell you when, but I think you're still going to wait a bit. And then persons over 18 with comorbidities, I think that number is hugely underestimated, because we have a lot of people with comorbidities, and recently they only printed or published the definition of a comorbidity. So I think there's a lot more than that. Those are people like people with diabetes and metabolic rate infections, those sort of things. Those are people with comorbidities. And then phase 3 would be the rest of the population over 18, your youngsters, your school-going kids. Obviously, they're lower risk, so we'll leave them to last. This is the plan, but it's not working as such. Recently, you would have heard that there was a court case between AfriForum and the Department of Health, where they challenged the Department of Health to say, but why can't we procure the vaccine privately and give it privately? And the government turned around in court and said, well, we never said you can't. So as that precedent has now been set, it sort of means that there can be a way for private companies like medical aids to procure the vaccine, but there's a lot of logistics and wrangling and costs and politics involved. As you know, South Africa is. So yeah, what some of us are trying to do is through our healthcare providers. So for example, we have a healthcare provider that provides all the health facilities for our company's employees. We're trying to procure the vaccine for our people. And it's a slow process, but it's moving forward. So when you will get the vaccine, I cannot tell you for sure. Hopefully sooner rather than later. But if you go on what's currently happening, it doesn't look very good. There are countries that are now talking about vaccine holidays, and there is some countries that are, if you have enough money, you can then go and stay there and get the vaccine and then come back. But for the majority of South Africans, and for us, that's not going to be practical to go on a vaccine holiday. But yeah, there is talk about that, that some countries are going to offer that. So if you've got a bit of spare cash lying around, that might be your better option, is to go for a vaccine holiday. Let me know if you go and what it costs you. Yeah. Right, then just a bit of facts about the J&J vaccine. As you know, that is the most important one at the moment for us. It's a single dose vaccine, whereas the Astrazeneca vaccine is a 2-dose regimen, meaning you go for the first shot and then you wait 12 days and you go for the second shot. The Johnson & Johnson is a single dose vaccine. Now, don't read into that in that, yes, but if I'm getting 2, it's more effective. It's double. It's not like that. It's got nothing to do with how much or how the vaccine is administered. It's exactly the same thing. It's just different ways that the vaccine is produced and different technologies used to design the vaccine. Again, efficacy against pre-existing variants, 66% overall, 85% against severe disease, 100% against death. There was pre-existing variants before the 501Y2. Yeah, we see again against the new variant, the South African variant, 57% overall, 85% against severe, 100% against death. Compared to the other variants, I'm not sure yet. So against, for example, the Brazil variant, the P1, or the UK variant, I'm still waiting to see the numbers. But I mean, obviously against this one, those are the efficacy numbers. Storage between 2 to 8 degrees Celsius. So it's a lot more user-friendly to store in terms of logistics. You would have remembered that the AstraZeneca vaccine and the Moderna need very specific cold room requirements, minus 50 degrees Celsius or something silly. Obviously, we don't have that technology everywhere. So this is a lot more easier to store in a normal fridge in a clinic or a healthcare facility. So you would have seen that that number was South Africa will receive 9 million doses. That was the initial plan. What's bothering me is that we haven't heard anything on when are more doses coming in. Haven't heard anything. Doesn't seem to be reported in the news and in the media, and the Department of Health is not saying anything. So a bit worried about that. When will more doses be received? The Americans have also caught on to the J&J vaccine now, so you can imagine that they're going to buy the bulk of the J&J vaccine. And yeah, I don't know. It is a bit of a worry, and I think it's the number one question is, when will I get the vaccine? Fortunately, nobody really knows. We have to wait. So there you can see, this was the graph taken yesterday of daily COVID-19 vaccinations administered in South Africa. So you can see that little trend doesn't look good at all. It's going way down. And you can see we have a serious health crisis in South Africa. Even before COVID, we don't have enough healthcare professionals to be able to administer the vaccine. I saw the other day what the UK is doing, very clever idea, is that you can go and do a course as a normal citizen through St. John's Ambulance, and they will teach you how to administer the vaccine in a healthcare setting, and they've automatically increased the amount of people, they've doubled the amount of people that can give vaccines overnight. So I'm not sure why we're not doing that. There's many people, including myself, who has had healthcare training, would be more than willing to do it for free. So I don't understand why we haven't looked at that yet. But yeah, it doesn't look good on the graph. Doesn't look good on the graph. Let's hope it picks up, but the trend is down. Most important question that I get a lot is, what can I do when I'm vaccinated? So must I still wear masks? Hana, hana, hana. And this is a very good slide that explains it to you in detail. Last night, the CDC updated their requirements on what you can do if you've received the vaccine. So vaccinated with vaccinated people are those immune due to the previous infection. So previous 3 months after receiving final dose, if that's a 2-dose vaccine, and you need to wait for 14 days. So even with the J&J vaccine, once you've got the vaccine, you need to wait 14 days. And that 14 days has obviously got to do with priming the immune system. Remember, you've now given your body the vaccine. It needs time to build up that defense and the intelligence to be able to respond. So 14 days after the dose, vaccinated persons can interact without restrictions among vaccinated people. And as I mentioned, this slide came out 2 weeks ago, but last night the CDC, you can go to the CDC website, and they've actually updated the requirements now for people that are vaccinated. So they also say that you can now meet with people that are vaccinated, and you don't have to worry about masks anymore and social distancing, and you can hug and all those funny things that we love doing between vaccinated groups. Vaccinated persons do not need to quarantine if exposed to a person infected with SARS-CoV-2. So you remember we had this whole quarantine thing of 10 days where you needed to quarantine if you came into contact. That will now automatically disappear, but you still need to remain vigilant. So the good news is, based on what the CDC published last night, that you could then go back to some sort of normality and get rid of the masks. I don't know what the South African government will do in terms of that. Obviously, it's law to wear a mask, so they might decide to keep the masks until we've reached herd immunity. But in your house, you then don't have to, you can bring people over, you can hug, you can do your thing without masks and without social distancing. Vaccinated with unvaccinated. So obviously, as I mentioned, this will happen in phases. So vaccinated persons can potentially be symptomatic or asymptomatic carriers of the virus and transmit it to the unvaccinated, although the risk is very small. So once you're vaccinated, you're still going to have to, unfortunately, stick to the non-pharmaceutical interventions, meaning you'll have to wear masks, you'll have to social distance, because although you've been vaccinated, you can still be a carrier of the virus and infect people. So you would need to adhere to all infection prevention precautions in public. Unvaccinated persons should still quarantine, so we know that if you are exposed or infected and you are not vaccinated, you will still have to quarantine for 10 days. Unvaccinated with unvaccinated, well, that goes without saying. Everybody will still have to, unfortunately, adhere to all the current rules and regulations and all the non-pharmaceutical interventions. But the good news is that it looks like if you're vaccinated and your family is vaccinated, then you can sort of get to some sort of normality. So what happens after the shot? Will I still have to wear a mask? Yes, although you are protected from COVID, you can still spread the infection. Remember, you are protected from COVID, not from the virus, but you can still spread the virus. Will I need 1 shot or 2? If you are given the J&J vaccine, you will only require 1 shot. However, other vaccines may require a follow-up dose, depending what we're going to do. Again, there's no clarity from the government whether we're going to stick with J&J or whether we will go back to Astrazeneca or to Sputnik or something like that. We don't know. But it can be that you would require a follow-up dose. Will I need a new shot next year? Well, we can't say for sure because we won't know how long the immunity will last. But it is expected that this may be a reality. So you might receive the, well, maybe only in 20 years, but you might receive the shot this year and you might require a new follow-up shot next year, depending on how well immunity lasts and what happens to the virus in terms of variants and mutations and stuff like that. So that could be a reality, but for now we don't know. So in conclusion, is the vaccine safe? Yes. There will be mild discomfort and there might be a little bit of allergic reaction, but that is very minimal. Will it protect me? Yes, it will against COVID, hospitalizations and death. It's unfortunately not going to protect you against infection. You might still get infected, but you won't get COVID. You might get mild COVID or a couple of sniffles, but hospitalization and death, definitely. Will the cost be covered? In all possibility, yes. And this is where the fight is, or the negotiations are currently. Will the medical aid cover the cost? Will the government cover the cost? Will the medical aid cover some of the cost? Will the government cover other half of the cost? This is where it's all becoming dark and murky. Is in all possibility, yes, it will be covered. My feeling is if you're going to want to get the vaccine quicker, you might have to fork out the money out of your pocket. If they go the private route, which I think they're going to have to speed it up. So in all likelihood, what's going to happen is that there will be private procurement of the vaccine. You'll have to pay that out of your own pocket, but if you want to go and stand in the line, that will be covered. That's what I think is going to happen. When will things get back to normal? This is difficult to say, but we hope once we reach herd immunity to go to pre-COVID days. So the quicker we reach herd immunity, guys, the quicker we can get back to some sort of normality. Again, I wish I had a crystal ball to tell you how quick that will be, but I don't know. It's like I said, average vaccination 6,000 a day is a drop in the ocean. It really is nothing. But my view is we will still go through some sort of third wave come winter. How that third wave will look, I don't know. It is worrying because we're definitely going to hit some sort of third wave, but what it will look like, I have no idea. I think it's going to be driven by the new variant, but again, what the numbers will look like, I don't know. We might go into some sort of lockdown like we did now in a level 3. I don't think we'll ever go back to a hard lockdown, a level 5 lockdown. I just don't see it happening ever again, but we might have some restrictions again going into the third wave, possibly even a fourth wave, until we can reach herd immunity. So that's me for the webinar. I don't know if there's any questions. Please post your questions now. You can also please go to polling. There's a poll, and the question is, will you be getting the vaccine? So I'm going to launch it now. And it's been launched. You can quickly attend the poll. And the question is, will you be getting the COVID vaccine? Yes, no, not sure yet. Please just take the time to answer the poll for us. I hope this provided some information into vaccines for you. If there's anybody that wants more specific information regarding vaccines, please feel free to contact us. Whatever I don't know, I will go back to our healthcare provider and people that I'm connected to in the field. So there's something you specifically want to know and I don't have the answer for you, I can find out for you. But yeah, let's hope that this all happens fairly quickly and that we can then get on with it and move on, and COVID-19 becomes endemic, not a pandemic, but endemic. So I'm going to end the poll. And yeah, I can see just a quick feedback on the poll. So 100% of people voted and everybody said yes, they're going to get the vaccine. So very happy to hear that, guys. Nobody said no. Nobody said I'm not sure yet. That's very good news. And all we can do is wait now. So we'll post more information for the Refraline employees that's on the vaccine webinar. We'll post some information on our intranet system and onto the WhatsApp groups. For those of you from outside the company that's also on our information group, we will also post when we know more about vaccines. So stay tuned. As soon as I know where I can get the vaccine, you will be the first to know. Thank you very much for the time, and hopefully we talk soon. Goodbye.